My husband can help me.
So my husband wasn't able to help me. He had all of the same baggage as well as an additional bag. And everyone that we were deployed with all had their own bags. So I had to drag it myself. And when I got home, they sent me to a doctor. They did an x-ray and they sent me to physical therapy. At the 10th session, I was in so much pain I couldn't move. I was crying. The physical therapist said, you have to go see the doctor. So they did an MRI, and the MRI said, you have a bulging disc, a herniated disc, and a tear that's leaking spinal fluid. We're going to send you to a surgeon. So they sent me to one of Tulsa's best surgeons, I believe, Dr. Boone, and he did a spinal fusion for me. He fused my L4, L5, and S1. It's my lower three. And when he went in through the 6-inch incision, sucked all the bone marrow out of my hips, and used that with some synthetic material to create a circle of bone material to fuse it together. So what I have been diagnosed with since is failed back surgery. The bone fusion worked, but they had put in the hardware. I could feel all the screws. I could feel my tendons snapping over the screws, every movement that I made. Plus I also have PTSD, and so I would wake up screaming night terrors in the middle of the night, sit straight up in bed, and after a spine surgery like that, of course you can imagine how that worked. I had to use wheelchairs and walkers, and my hands started going numb, so they had to do surgery on both of my wrists and my left elbow to move the ulnar nerve so that I could have use of my hands. And then at the year mark, they had to go in and take out the hardware because I was having so much problems with the hardware. So the bone fusion itself is fine as far as spinal wise, but I have the second incision through the same muscle all filleted back and everything and put back together. So I have massive just pain, a lot of nerve pain that just shoots and it's constant. Every time I step on my left foot, it's like stepping on kind of like a tack or whatever, where it just shoots up your leg or down your leg, I should say. It's just all the way to the toes, but I feel like I'm always in constant pain. And like I said, this year has been a different year for me. My pain is not gone. I do have to do pain management classes. I do have to continue to work on positive thinking and all those things that kind of help me. I still do therapy every single week for PTSD and depression and all of the other things that go along with an injury like that. But the NeuroLumen has changed my life, and I want everyone to know what an amazing product it is, and that it is something. It may not work for everyone, but I cannot imagine it wouldn't work for everyone because it's amazing. It just the science behind it alone, and the testimony of people that like me who it absolutely has changed my life.